Know that 70% of patients of blood pressure can get erectile dysfunction. Good evening, friends. My name is Dr. Anirban Biswas. I am a diabetologist practicing in South Delhi. After the last talk about how to increase your height and how to lose weight, today we are dealing with another good topic on sexual dysfunction. So there are a few questions which I am going to answer. What are the types of sexual dysfunction in males? So the first type is erectile dysfunction, in which the organ doesn't get hard enough to penetrate. The second is premature ejaculation, in which there is ejaculation very soon after starting of sexual intercourse and doesn't last that long. And third is loss of libido or the lack of sexual drive. So the causes, first is hormonal, less testosterone level, which is the main male hormone in the body. Second is drugs like antidepressants, antipsychotics, antihypertensives. Yes, antihypertensive is also important. Most of us know that 70% of patients of blood pressure can get erectile dysfunction because of antihypertensive drugs. So this is another thing which needs to be taken into consideration. Blood pressure itself, diabetes, one of the leading causes nowadays, because India is the diabetic capital of this world. So diabetes causes neuropathy and it leads to lack of sexual drive as well as ED as well as PE. Smoking and alcohol, yes, these can cause vascular disturbances. And psychological, because of the modern stress and anxiety, depression, then any past history of sexual trauma and marital disharmony, all these things can lead to this is one of the big causes, because we see more and more people having psychosexual related sexual decline. And last is surgery. This is also seen in some cases of prostate or other bladder cancer or bladder surgery. So the diagnosis is based on mainly three things. First is the hormone analysis, which needs to be done. Second is if the vascular anatomy needs to be evaluated, then we need to go for a penile Doppler. And the third is psychosexual or the psychological analysis, which is another important thing. So this can be done through cross referrals across a physician, endocrinologist and a psychologist or psychiatrist, and sometimes even a urologist comes into play. The treatment is mainly medicines. There is phosphodiesterase inhibitors like sildenafil, Viagra, you know very well, sabko pata hai. So that is a important medicine which can be used in such diseases. Then hormone replacement therapy, like lack of testosterone, we can add testosterone, और आजकल ऐसी दवाइयाँ भी आ गई हैं जो डायरेक्ट टेस्टोस्टेरोन को जगह इनडायरेक्टली टेस्टोस्टेरोन का लेवल बढ़ाती है. सो ऐसी दवाइयाँ भी हम दे सकते हैं पेशेंट्स को. एंड psychological therapy, which is again provided by either a psychiatrist or psychologist after the diagnosis has been made, which sometimes leads to no medicines at all. You don't require any medicine, just counseling sessions with the psychologist or psychiatrist can help, and this is indeed has been proven in various studies. And the fourth is other methods like vacuum and penile implants, which are surgical or mechanical. So these are the ways by which we can treat sexual dysfunction. The question arises whether sexual dysfunction and infertility or sterility is the same. No, it is not. Infertility is basically not able to produce children, but it has nothing to do with sexual dysfunction. A patient may be sexually potent, but he may be not able to produce children. So that is another aspect for which a comprehensive analysis of the male and female partner should be done. So with this, I hope you have learnt well. in today's topic, and I'll be waiting for your queries and questions, and will be very happy to answer them. So if you have any queries, or if you want to book an appointment with me regarding your sexual queries, then please you can book the appointment. Thank you, and stay well, stay healthy.